It's really an honor to be here, and I'm going to do exactly what Don said. I'm going to tell you about some questions that I've been asked when I've been in the clinic and then provide some data to explain why I try to answer them the way I do. So with no further ado, let's go ahead. The first question: what is the one nutrient I can take to prevent cancer or cancer recurrence? This comes up quite often in the clinic, and in response, I'd like to reference the study presented here, effect of selenium and vitamin E on risk of prostate cancer and other cancers. This was a very large four-arm trial that was based on preliminary data that looked at selenium and that looked at vitamin E that suggested that both might have a role in preventing cancer in people at high risk for prostate cancer. Again, this was a four-arm trial that checked either selenium versus vitamin E versus both versus placebo, with the primary endpoint being, can prostate cancer be prevented by one of these micronutrients or by both of these micronutrients? What do you think this number refers to? Well, this is the number of patients who, I should say, individuals at risk for prostate cancer who were enrolled in this study. This was an exceptionally large study with 35,533 men enrolled. And I should say and clarify here, these were healthy men who were enrolled in the study with the goal of trying to have their prostate cancer prevented over time. What do you think this number might refer to? I'll give you a hint. The cost of this study, which was undertaken several years ago, was $110 million. And in today's figures, that cost is likely even higher. So this was also a very expensive study. So what were the results? If you looked at cumulative incidence of prostate cancer, you could see that these curves are right on top of each other. In other words, neither vitamin D nor selenium, nor both given together, decreased the incidence of prostate cancer. Moreover, when they looked at other cancers, there was no decreased incidence of any other cancer in this group of healthy men. Any other cancer, whether it be lung cancer or any other cancer, also was equal among all four arms. But interestingly and notably, when you looked at the follow-up data on this study, and specifically at the 10-year data, you see a concerning finding in the vitamin E arm. There seemed to be a slightly greater incidence of cancer risk among the patients, or I should say individuals, who have been treated with vitamin E, which raises a concern that giving one micronutrient to an otherwise healthy group of individuals may not be such a good idea. So the conclusion from this trial is that selenium and vitamin E, as prescribed in this study called the SELECT study, do not prevent prostate cancer in healthy men, and based on the 10-year data, might even lead to harm. But I think there's another important lesson here. What else did we really learn from this study? And the answer is a single nutrient approach does not appear to be the answer. I think these days, if anyone tries to mount a study that looks at a single nutrient in an otherwise healthy group of individuals, first, one would have a very hard time getting individuals to sign up for such a study. And secondly, one would have a very hard time in getting that sort of a study funded.